All right. Well, thank you for joining me today for our first Wednesday webinar. It's a series that we're doing at Shenzhen. And this is our first one. We're going to be shedding light on manual lymphatic drainage. My name is Bob Jones, and I'm the owner, clinic director, and a licensed massage therapist at Shenzhen Health and Harmony. We're an acupuncture and massage clinic on Chicago's north side in the Lincoln Park neighborhood. We've been there for, almost 20 years now, and we hope to have another 20 years in the future. We are dedicated to making your lives better by any means we can, sharing our gifts, and in this case, manual lymphatic drainage. And today, I want to share with you why I think manual lymphatic drainage should be an addition to your regular health regimen. But before I get into it, I want to do a couple of housekeeping notes. A couple reminders at the clinic that we're available at the clinic 7 days a week. One of those days, Sundays, is appointment only. Ernest Krolik, our clinic manager, is offering Qigong instruction one-on-one, but you have to book online or call the clinic 773-935-4325 to schedule that. It's a great complement to everything that we do. We also have two new practitioners with us. Cindy Theo is a massage therapist who's been in practice for 17 years. She brings her gifts to us. And also, Michelle Jimenez is a new acupuncturist with us. She's brand new to acupuncture, she's newly licensed, but we're already getting great feedback about her session. So welcome, Cindy, Michelle, and Ernest. And also, all attendees today will be receiving a code for 15% off of a future manual lymph drainage session. So if you're in attendance, you'll get that code at the end of the session. Okay, so, or I'll email that to you if you have to run, and that's okay. So thank you for joining us. Let's get started. So I've known about manual lymphatic drainage for as long as I've been at Shenzhen, and that's almost 20 years now. I first learned about it because one of our practitioners, Roger Hughes, who's with us on the call right now, he has been practicing this for 25 years now. And I've always known the basics about it, like the intention that it's supposed to help with edema. It's supposed to help boost our immune system. And I know that it incorporates a light touch, that it's not like a regular massage, but I didn't know all about it. And I still don't know all about it, but I wasn't super, it didn't excite me until I took a class recently for continuing ed about manual lymphatic drainage. And that's why I'm excited to present this to you, because I really think that it should be part of everyone's regular health regimen. So I'm going to share my screen. And we'll talk a little bit about why I'm so excited. So manual lymph drainage, so first of all, what is the lymphatic system? It's a network of vessels that maintains fluid levels for the body, transports damaged cells cellular waste, cancer cells, bacteria, fats, etc. I mean, it's like the body's sewer system. And this sewer system has a network of, well, the vessels, but you can think of them as pipes. And the fluid in these lymph vessels is called lymph. And this lymph is like, okay, so we're talking about a sewer system. Let's say you're in your house and you're using the sink, and that water goes somewhere. That used water goes somewhere. It goes into the sewer system, into a small drain that gets transported to a larger pipe, that gets transported to a larger pipe, that gets transported to an even larger pipe. And then eventually it ends up in a processing center. And in that processing center, and I'm going to move forward to a diagram here. Oh. All these thin little lines are lymph vessels. The smaller ones are in the extremities and deep all over the body. And when lymph gets taken from these small pipes, they get taken into larger pipes and into larger pipes, and eventually into a big drain. This is the thoracic duct. It's one of the main drains. There are several areas where large drains are located. And the big ones are in the cervical or neck lymph nodes, the lymph nodes in your neck, your armpits, the axillary lymph nodes, and the inguinal lymph nodes in your groin. That's where a lot of them tend to be. If you have a swollen lymph node when you get sick, generally they're going to be probably around the neck, in the armpit, or even in the groin. And that's where a lot of the processing happens. So lymphocytes are what take some of these impurities, these waste products, these dead cells, these damaged cells, out of our body and transport those damaged cells to the processing centers of the nodes in order to get rid of them. Lymphocytes are made, they're made in the thymus gland, right here, and also in the bone marrow, hence T and B cells, thymus and bone marrow. And they travel through the blood to find these problematic cells in order to grab them and flush them away. The lymphocytes migrate to the lymphatic vessels via the capillaries, and the lymphatic system roughly parallels the cardiovascular system in that the capillaries, the lymphocytes can move from the capillaries of the cardiovascular system into the lymphatic system for processing in the larger nodes. So, and that's when the waste material is removed from the body. Now, one of the things that separates there are two big things that separate the cardiovascular system from the lymphatic system. One of them is that the lymphatic system is not a closed system. It's whereas the cardiovascular system is more of a closed system. It's just constantly circulating. But the lymphatic system depends on the cardiovascular system to get these lymphocytes and search for invaders and get rid of the impurities. The lymph system is also responsible for regulating and maintaining proper fluid levels. So if you've had too much water, if your system just has too much water in it, your lymph will absorb that, your lymph system will absorb that water and help get rid of it. The second big thing about the lymphatic system is that it has no pump like the cardiovascular system does with the heart. And the lymphatic system relies on movement, breathing, and hydration to work effectively. And that's when we come in, because when the lymph backs up, and it will at times, because it's overloaded with work, because maybe you're sick and maybe your body is just finding so many different things in your environment, and the system will back up just like a sewer would. So like when it floods, here in Chicago, sometimes we have torrential rain and it does flood, and homes flood in certain areas of the city, and they open the floodgates. They have to open the floodgates up north, and everything flows out into the lake. Now, the floodgates that we need to open, if things are backed up in the processing center, if there's just too much work, are the larger areas that open up into the thoracic duct, cervical lymph nodes, axillary lymph nodes, and the inguinals. I think everyone's been to the doctor, and where the doctor feels your lymph nodes in your neck just to make sure that nothing's swollen, because that could indicate that you're dealing with something that needs to be looked at. Now, that backup needs to be helped out with a pump. And in the absence of proper hydration, movement, or breathing, that's when we come in as practitioners offering manual lymphatic drainage. So what is manual lymphatic drainage, or MLD as we like to call it? First of all, no client is ever hooked up to a drain. We don't drain any fluid from your body. All of your fluid stays within your body. And MLD, in my mind, is not technically a massage per se. When I think about massage, I think about long flowing strokes, maybe a cream or an oil being used, and we're working with the musculature to relieve muscle discomfort of some kind. MLD does not address muscles directly, like at all. It addresses the body's lymphatic system almost exclusively. And practitioners use light rhythmic pressure, like really much lighter than the lightest Swedish massage you've ever had. About the MLD session, like I said, light pressure is used. Rhythmic pumping. We use a rhythmic pumping motion to promote the movement of lymph, because in the absence of a pump, we have to externally move the lymph through your body. And the lymph vessels are located very superficially, very close to just under the surface of the skin, the dermis. And this rhythmic pump, it doesn't take much because these small vessels are very delicate. They're not like blood vessels, which are basically made of muscle tissue. Blood vessels can contract, they can dilate, but lymph vessels don't. And if they're squished too much, there's too much pressure, no lymph is going to get through, or very little lymph will get through. That's my take on that. And the MLD session can be very relaxing. It's very relaxing. And depending on how much water you have in your body or how much lymph has collected over time, it's possible that you might need to use the bathroom, like during your session. And that's okay. If you need to void, you need to void. I'd much rather a client says something than tries to gut it out and survive without using the restroom. And lastly, each practitioner is different in style and approach, but the touch should be light. Some people, some practitioners might incorporate a little movement, and I think that's great because it helps the body, pump a little more. And I've been taught a recipe, but not everyone, especially people like Roger, who've been doing it for 25 years. He's beyond the recipe. A lot of us, we listen to the body. We are able to tune in and listen. And when your body talks to us, we listen. And if he's called, or if I'm called to another part of the body that's not conducive to the recipe, I'm going to honor that, because the recipe is a guideline. And when your body talks, we generally listen, just to let you know. So each practitioner is different in style. You'll probably never get the same treatment twice, but the touch should always be light. I found this, I wanted to get a video to show you how light that touch is. And I couldn't find much online, but I did find this. Sorry that it's so small. And this is a teacher somewhere, and she's instructing a class. And this is a model here who's helping with this treatment or this class. And I want to show you how light that treatment, that touch is. So I'm going to play. And I'm going to fast forward to what generally happens in the beginning of a treatment. She's starting the session, opening the cervical nodes, and see how light that touch is. Just stretching the skin, using that pumping motion. Very rhythmic. And she's just telling her class that she's not doing the complete work, but we always begin by opening the big drains first, because if we don't do that, then there's nowhere for the lymph to go when we open the smaller pipes. The touch is so subtle. But again, everyone has a different style. Generally, I think the touch around the cervical is always very, very light. I'm going to fast forward a little bit so we can see a different part of the body being addressed. Opening up the axillary nodes. And look how light that is. Clogged drain. Right, if you try to force everything out from the bottom, so we open the main drains and then we open the other drains that depend on the larger drains, and then we move toward the smaller pathways. I just wanted to show you a quick video, a quick scene of how light that touch is. Because if you've not had experience with manual lymphatic drainage before, you might not even know that it should be that light. I don't want that. Okay, nope. Okay, so you might be asking, why would I need MLD treatments? Well, there's lots of different things that MLD can address. It was developed initially to deal with lymphedema, excess swelling in the extremities. But over time, we've found that it helps with skin issues. I mean, skin issues are basically a manifestation of what might be happening in the body. And if the body can be, if the lymph system can be helped to process these things a little faster, maybe we can help clear up some skin issues a little faster. Maybe not all skin issues, but some, like acne or eczema, if it's not purely hormonal. MLD treatments can also minimize scarring, post-surgery, because MLD helps affect recovery faster and affect healing, because all those lymphocytes are taking away the stuff that we don't need and bringing back stuff that we do, or allowing the blood to bring nutrients to the tissue. It can be part of your training regimen for efficient recovery. If you're running a marathon or a triathlon, you're building up quite a bit of waste in the body, because you're exerting a lot, and the body doesn't need all of that stuff. And recovery is so important when it comes to training, that why not recover faster and more efficiently with something like MLD. Now, I wouldn't necessarily recommend an MLD treatment after every run, but for the long runs or periodically during your marathon or triathlon training or weightlifting or whatever you're doing, that it could improve performance quite a bit. It also would help with swelling resulting from a sedentary lifestyle. And I don't mean sedentary like just laying around the house all day, but desk workers who are sitting for a good portion of the day, some of the lymph vessels might be occluded or pinched off during that time. Let me go back to the diagram. If you notice, most of these vessels are situated vertically, and not many are horizontal. So if you're sitting all day, these lymph vessels here might be pinched off. Not completely, but things might be slowed. that could result in a buildup or backup of fluid in the lower extremities. It's possible that you've experienced swollen feet or swollen hands, and MLD can help with that. Now, let's get back to that. Okay. Also helping with swelling resulting from a sedentary lifestyle. MLD helps keep your immune system finely tuned. I'll talk about that a little bit later on my recommendations and how often I think is appropriate for the regularity of sessions. But MLD also helps alleviate symptoms related to seasonal allergies. I mean, every season brings a whole host of new environmental changes, and our bodies react to the environment. And those of us who suffer from allergies, seasonal allergies, can attest to how the symptoms make us feel. And why not use some MLD to help recover from those symptoms a little faster? Balances the body after being in a toxic environment. When I say toxic environment, what comes to mind when I wrote that are like airports or airplanes, where you're sharing air with maybe 100 or so, maybe more other people, you know, in a tin can, and yeah, that air is filtered, but you're still sharing air with everybody, and who knows what's going on with them. Or maybe you've been exposed to some environmental toxins, and that could right there cause a little stress for the lymphatic system. So we're here to help move things along and keep things from backing up. Past surgeries result in fluid buildup in the extremities. Again, most of those, most of the lymph vessels are situated vertically. Nowadays, I believe surgeons understand that a scar or an incision that's situated horizontally could prevent the free flow of lymph. Now, that lymph will eventually find its way back to the drain, but it's going to need some help. I mean, that horizontal scar will create a backup that doesn't need to be there. Now, surgeries now tend, a lot of them, if at all possible, tend to be vertical. So that prevents some swelling, but there still will be some swelling post-surgery just because the body is trying to recover. And if that edema, that swelling is allowed to sit for too long, well, that edema, the lymph in the affected area, it's not watery anymore. It gets viscous and sluggish and slow, and it can even get hard. And that, when it gets to that point, it becomes harder and harder, and sometimes impossible to get that lymph flowing again. So best to treat that very soon after surgery, and not let that happen. So what can MLD treat? This is just a short list of the different things it can treat, and we've talked about some of these already. Lymphedema, swelling, sinusitis, fibromyalgia, glaucoma, acne, cellulite, migraine. It can help you recover more quickly from burns. Obviously, post-op joint replacements and C-sections. C-sections, because you really can't have a vertical scar there. Maybe at one time there was, but right now every C-section scar I've seen has been more or less horizontal, and provides kind of a host of issues and some excess swelling. So we would like to help you with that swelling and recover from that scarring faster. And there's many more. This is just a short list of things that MLD can treat. Some contraindications, meaning when we can't help you with MLD, or when we need you to see a doctor, or when we need you to wait. Acute pain. If there's swelling because of an injury, we don't necessarily know what's going on with that injury. Maybe you've got a break or or a fracture. We'd like you to see a doctor first before we treat that. We want to know what's happening before we treat something. Fever could be indicative of an infection. Cancer. We don't want to spread anything. We don't want to spread cancer from a lymph node to the rest of the body. So we're going to wait and seek guidance from your doctor too. Active infections, obviously, that relates to fever, organ failure, that might be self-explanatory, and unidentified issues. When I say unidentified issues, my class called them UFOs, which my teacher said was unidentified funky objects, which generally are skin issues. But if we don't know what they are, then we would rather not treat them until we know what they are. And then wounds. When I say wounds, open wounds, we're going to let that heal before we treat anything. Those are some of the contraindications, greatest hits right here. And there are things you can do to help keep your lymph flowing very nicely. We sometimes need help with that pump, but things you can do every day are exercise regularly, stay hydrated, and practice breathing. Now, when I say exercise regularly, it would be great if you could, if you had a regular exercise schedule, but I understand time constraints. And if you are one of those people who have a desk job, stand up once in a while. Just get up and stretch your legs. Roger told me the other day that just getting up, standing up and sitting down for 3 seconds can help with movement of lymph through your body. But don't depend on one moment of 3 seconds every day to do that. It would be great if you could just set a timer for, I don't know, every 20 minutes, every hour, something, but keep moving and stay hydrated. Most of the fluid in your lymph most of your lymph fluid is comprised of water, and we want that to be watery, more watery than viscous. We don't want viscous because then it slows down. And breathing, deep abdominal breathing, can really affect all of the lymph in the viscera, in the your organs in your body. There's a lot of lymph centers in the intestines. Fats are taken from the intestines through lymph ducts into the lymph, where they're distributed into other areas of the body. So those are three simple things you can do to help keep your lymphatic system working. If you can do that, then you're already in a pretty good place. So my recommendations at the end of the day: MLD treatments quarterly to maintain health. It's kind of like an oil change, but I don't drive all day long. I'm in my body all day long, and my lymph system is constantly working, or I'd like it to be constantly working. So in order to maintain that, just like I would my car, I get my oil changes because I don't want my car to break down. I also don't want my body to break down. So I'm committed to getting MLD treatments quarterly to maintain my health, maintain my immune system, to give myself every possible chance to recover quickly from whatever's out there. So at minimum, quarterly, add that to your health regimen. And if you're planning a surgical procedure, if you're training for an athletic event, if you're experiencing seasonal allergies, or you just want to feel better, give us a call and we can put you in touch with a manual lymphatic drainage therapist, and you can make a plan. And we can schedule you before and after your surgical procedure, talk with you about what events you're training for, get you in for that quarterly MLD session, and if you just want to feel better. So thank you so much for joining me here. Again, I'm Bob Jones, and I'm a brand new manual lymphatic drainage therapist. I'm not ready to practice yet. I still have some practice to go, but Roger Hughes has been doing it for 25 years. Benita Santillanes is also trained in MLD, and we both look to Roger for guidance and mentorship when it comes to MLD. So this is our information, where we're located, 2764 North Lincoln Avenue. This is our phone number, 935-4325 in the 773. And you can text us on our messenger at 773-232-5625, or book with us at shenshenhealth.com. So I'm going to open this up to questions. And I don't know if anyone has any questions. Roger, do you have anything? He's been with us on the call, so this is our own Roger Hughes.
Yeah, Bob, I do. Thank you for this. If I was going to schedule my first MLD session, would it be wise for me to, make room for the rest of the day to basically just absorb the session, the treatment, or can I go? What you would recommend that I just go straight to exercising after? I'm just wondering what would be the best way.
I think for me, I guess it would depend on the person, but I don't think I'd schedule an MLD session just before a workout. I would want to I would want my body to acclimate to its new condition. I think I would hydrate well after the session, eat something really clean, and I would probably rest afterwards. Going back to work is probably not an issue, but if I do go back to, if I were at a desk job, I would make sure that I take frequent breaks to get up and move around. But I would prefer to rest after my MLD session.
Thank you.
Yep, sure.
Mm-hmm. Yeah, I don't think I have anything else to ask. I thought that was really informative. I enjoyed it.
Well, I'm glad you did. I'm glad you did. And we're going to be posting this. If you're seeing this, after the fact, please give us a call. And if you have any more questions, you can always you can email me at bob@shenshenhealth.com, or if you have a general question or want to schedule an appointment, you can also email info@shenshenhealth.com if you'd rather not call or text. So thanks very much. We're going to be posting this on our YouTube channel. We do have one, Shenshen Health. So we'll see you then. Thanks so much.